Let's do more on COVID-19. And the fight against COVID-19 requires consistent and deliberate strategies in order to succeed. In the first 2 waves, many Ghanaians fully observed the protocols, whilst government also did what it had to do to suppress the virus in almost every community through consistent risk communication campaigns, disinfections, and the enforcement of executive instrument, similar to what China did to bring the virus under control. In our third wave now, and all these are either low or completely missing. Individuals are no longer taking precautions. The assembly seem to lack the enforcement power. And government seem to have also cooled interest in fumigating markets, schools, lorry stations, and other public places. Even the regular COVID-19 updates appear to be suffocating underwater. In the midst of this, many continue to contract the virus, with the Delta variant now said to be dominant, fueling more severe and critical cases and much worse deaths. We definitely know how we contained the virus in previous waves. So why have we allowed COVID to batter our country and stretched our health facilities? This afternoon, we've brought together all those who matter in the chain of infection prevention to try and understand what the situation really is and what we can do as a people to subdue the virus. Dr. Da Costa is joining me this afternoon. Dr. Da Costa Abuaje is Director of Health Promotion at the Ghana Health Service. Also in this conversation, Dr. Kofi Boni, who is a senior research fellow at the Noguchi Memorial Institute for Medical Research, will be joining us. Joyce Efutu is Director for Communication at the NCCE on Education. He'll be joining us also. And Emma Adjoa Apio Seidria, who is Director of Communications and Corporate Affairs at Zoom Lion. You remember Zoom Lion led the fumigations in the markets and public places. Would also like to hear from you as the discussion gets underway. Send us a WhatsApp. The number will be on our screens. You send us a WhatsApp, and we'll also open the phone lines for us, for you to send us your comments. We'll be reading them here on the pulse. Let's start with you, Dr. Boni from Noguchi. Why are we here? I thought that we were making a lot of progress in our first and second waves. All right, so Dr. Boni, if you cannot hear me, let me go to Dr. Da Costa. Dr. Da Costa, I spoke with you a few days ago, and you assured us that the Ghana Health Service was in charge, and the Ghana Health Service was intensifying efforts to ensure that we overcome this challenge. It does appear that our cases are getting worse by the day. Hello, Dr. Da Costa. All right, so I think Dr. Da Costa is also now trying to join. Dr. Da Costa, are you back? All right, so Dr. Da Costa, I'm asking you to tell me why our cases are getting worse by the day, because you assured me on this same platform a few days ago that you were intensifying efforts to curb the situation.
Thank you very much. I think you know that now the Delta variant has actually taken over from the Alpha, as it was put forward by our scientists. Now, the transmission of that is obviously very variant and rapid. So what we now have to do is to appeal to people to wear their face masks, to make sure that they comply with the safety protocols. In fact, since I spoke to you, we have actually been engaging all the regional ministers to make sure that the various RECSEC groups are actually activated with the AMA task force to make sure that they enforce the COVID-19 rules in their various regions. Just this afternoon, the Volta region, which is an emerging hotspot, the regional director issued a statement to enforce the COVID-19 safety protocols. Ashanti region are further engaged with the regional director of health service and also the regional minister. And they are also making sure that enforcement is enhanced. In Greater Accra, Honorable Henry and the team are working so hard to make sure that the enforcement of the COVID-19 protocols are strictly adhered to by citizens. So we are doing our best, but like I said, there is a responsibility also on the citizens and on the citizens to make sure that they conform. So that's what I would say.
I drew your attention to the fact that basic hygiene equipment that would enable people overcome this virus are not available, at least at our public facilities like the transport terminals, like other public places. And you assured that this would improve. Has it improved?
Okay, so let's look at it in three phases. So if you look at the workplace, the responsibility is on the employers to actually provide those facilities for their staff. So, for Ghana Health Service, if you go to some of our facilities, like here, you'll see that we have provided for our staff. Then in, let's say, the public places where obviously the local authorities are in charge, we have really notified them to provide those facilities for their, for those places so that people can comply. We have also, I think, for the transport unions, I told you, yes, we've had further engagement. Even as of this morning, I had an engagement with some of them that they have to provide the washing facilities at the various stations for people to wash their hands. So it's work in progress. Let's say that it is really work in progress. You certainly know that when the disease actually goes down, then the behavior of the citizens also changes. So now, going up,
I'm doing some Zoom call.
We are trying so hard to make sure that the citizens comply. And it's exactly what we are doing with our various stakeholders.
No, I'm yet to see it.
Dr. Da Costa, hold on for me and let me bring in Joyce Futu, who is the communications officer at the NCCE. Your duty is to inform and educate the people on their constitutional rights. Now, what held us in our first and second waves was the fact that there was a lot of education, creation of awareness, there was updates and information on prevention, and even reminders for people to stay safe. All of that has stopped. What's the role of the NCCE in getting this running? We lost Joyce Futu there. Dr. Da Costa, if you're still there for me, let me put this question back to you, Dr. Da Costa, because in our first and second waves, we saw, intensified risk communication. You really created awareness, education, information, knowing very well that as time goes on, people tend to forget some of the things. We've not seen much of that in this third wave. And the reason people are getting more infected, why have we stopped the communication?
Thank you. Let me say that we haven't stopped the communication. The fact is, now you certainly know that everyone in Ghana knows that they have to wear the face mask. And you see, like I explained the last time, the awareness and the information alone will not obviously curtail the virus, but the enforcement of it will help us. So if you look at this time around, we have focused more on the enforcement because we believe that people actually do know the safety protocols, which we have not changed. But the enforcement is crucial to support the awareness and the information that we are giving to the population. I told you last week that for Ghana Health Service, all programs that we do, we educate the population, and it has become part of our normal programs that we do. So we have not stopped. We have intensified community engagement activities, the traditional leaders, the churches. I mean, I'm in contact with all the regional health directors, and you can see that work is actually ongoing. But the outcome is what the outcome should be. The outcome should be behavior change, where we see that people are wearing their masks. And like I said, we really have to make sure that the enforcement aspect is enhanced so that it complements the education that we are giving.
Right. So the enforcement bit is where I'll be taking you next, because you assured me the last time that you are collaborating with all the security agencies. I'll have you hold. I'll come back to you on that one. But Dr. Kofi Boni is here with us now. He's a senior research fellow at the Noguchi Memorial Institute for Medical Research. Dr. Boni, why are we here now? Because we thought we were doing a lot well. We made a lot of progress, in our first and second waves.
Thank you very much for the opportunity. That's a very good question. Why are we here now? For very reasons. I mean, we are here now because we are simply not adhering to the protocols. One, it's unfortunate that we also have a virus in our hands which can easily mutate and take on new forms, which we call the variants. So we have a variant that maybe is more adaptable, more transmissible, and spread faster. So that is that unfortunate bit. But then if we are keeping to the measures that we know, I think the level of talk about the spread will not be as we are seeing it. We will keep having the virus continue to mutate so long as there is, it's circulating in the population, because that is how viruses are. But then we, on our part, can let it go down, the spread go down, if we keep to the simple measures that we have in place. So we are here now because, one, we unfortunately have a virus in our hand which can easily mutate, take on new forms, and become more transmissible. And the second thing is that we are simply not adhering. A lot of people are not keeping to their protocols. That is why we are here now, to answer your question.
Dr. Boni, what is so different about this Delta variant we're told is causing a lot of wreaking havoc in our hospitals? We're told that, is it not the same virus mutating the first one we saw?
Yeah, if you say the same virus, then it's not. Because you see, viruses need to more or less adapt. If they are growing, and maybe we are applying some measures to reduce their growth, they will also have other mechanisms to evade the kind of measures we are applying to. So these viruses more or less changes because they grow very fast. So they change in their genetic makeup, and that will result in a slightly different variant. In other words, subset of what we used to have. If they change in their genetic makeup, and they bring up new proteins, some of them can help them to adapt better. Some of them can also help them not to adapt better. But unfortunately for us, we had changes that help them to adapt better. Adapt better means now they can infect more cells. Infecting more cells means they can have the ability to cause more disease. And if they cause more disease, one become more infectious. So if you become more infectious, you tend also to give the virus out to many people. So this is what we are having. So long as there is spread, we are going to have this virus keeping mutating, to keep changing. So if we don't curtail the spread, then it is possible we can have different variants in the near future. That is, if we still have this virus circulating in the population at the rate at which it's doing now. So long as there is spread, we will have these changes. So the virus we have is different from what we used to have because there has been some changes in the genetic makeup that has made it more adaptable, more transmissible, or more contagious, more transmissible, and now it's causing more havoc in the population. So it's different.
Great. So one of the things that really helped us to control the cases during our first and second waves was the fact that we were fumigating our markets and other public places. And you know, Zoom Lion was championing that cause. Thankfully, Emma Adjoa P.L. she's Director of Communications and Corporate Affairs from Zoom Lion. She has joined us. Emma, let me put this straight to you. Why have you stopped the fumigation? Emma, kindly unmute for me. Hello, Emma.
Okay, thank you. Can you hear me now, please?
Great.
Thank you. I was saying that we have stopped because the assignment that was given was for a period. And when it ended, we had to stop. Aside that, when the government calls us anytime, we are ready to embark on the assignment to do the disinfection.
I thought Zoom Lion also did some pro bono jobs without any assignment from government.
Yes, we did pro bono jobs at specific places. And for a wider range, like the whole country and all the markets, all the schools, everywhere, of course, we cannot do for free. So we definitely need some arrangement with the authorities so that we can go in and do the needful.
All right, so thankfully Dr. Da Costa is here. Dr. Da Costa, why have you not given Zoom Lion or any other company the assignment to do the fumigation? Is it that it's not necessary now?
Thank you so much. I think, to the best of my knowledge, I think the schools were fumigated before the students actually went there. And now I know the market fumigations were under the local authorities, so I'll have to seek more information to the reasons why they are stopped. But it was really an integral part of the exercise that we did at the first and second wave. So certainly I'll have to seek clarification from the relevant authorities why it stopped. I don't have the information now, but I certainly know that the schools were fumigated.
Okay, so I'll come back to you on that enforcement conversation, but then now Joyce Efutu is back on the line. She's Director for Communication at NCCE on education. Joyce, why have you stopped the education? Because we know that in our first and second waves, one of the things we did very well was risk communication, information for the public, creating awareness. All of that has stopped now.
Yes, good afternoon. We haven't stopped the awareness creation. Even before the president's address to the nation for the third wave, we were still educating the public. In fact, the Commission mainstreamed COVID education in all activities that we are undertaking. And currently, our vans are in town and across the nation, our district and regional offices are all engaging Ghanaians on the need for them to adhere to the protocol. But information from the field is that people are not adhering. I think you know, when you go to town, you find out that people are not adhering to the protocol. So if we have the enforcement bit, I think it will help us. There's no Ghanaian who doesn't know what COVID is and what they have to do, but just that they are not adhering to the protocol. So if we can have the enforcement aspect, I think it will help our sensitization activity.
Well, let's look at what differently we can do. Going forward, what will be the strategy for you at NCC to get a lot more people to get the information, but also to make use of it?
We are still engaging and telling people about the strain and how it multiplies faster and the need for everybody to adhere to the protocol so that we can protect ourselves and others in our sphere of contact.
Dr. Da Costa, she made mention of enforcement, and that's where I'm coming right now. You assured us that you're collaborating with the security services. Now, if people do not want to obey, they must be forced to do so. Where has that, where are we on that now?
Okay, thank you. Before I get there, let me put this on record. You see, behavior change is not that easy. It is really a process. And bear in mind, in some countries, they are even demonstrating because they have been asked by authorities to wear face masks and others. We have been lucky here that during the first and second wave, we got a lot of people to obviously wear the face mask now, and the other restrictions as well. Now, to us from the Ghana Health Service, like from the NCC, we engage them a lot and we work with them collaboratively with the Ministry of Information. We will put out the information. We've come out with the protocols. All we have to do is to continuously disseminate. Now, the enforcement bit is to support our activities. Yes, we've not stopped. We are continuing our engagement with the regional ministers, the various research groups, the AMA, the police. We are continuing, and trust me, it went down to absolutely virtually about less than 1%, but still it's coming up gradually. So, like I narrated earlier on, we engage Volta region, which is an emerging hotspot. This afternoon, Dr. Lecha, the regional minister, actually issued a statement enforcing, admonishing the citizens in Volta region to obey the COVID-19 protocols, outlining the various sanctions for them. Honorable Henry Korte has done same in Greater Accra. So it is a process that we all have to go through. And thank God, now the vaccination exercise has also started in Kumasi, the Johnson & Johnson one. So all these things are to complement the education that we are doing for Ghanaians to obviously know what is happening and to comply. But the basic thing is that the protocols have actually not changed. It's the same. So let us also do our part. The responsibility bit also is on the individuals, which is the citizens, to make sure that we are doing our part to support the Ghana Health Service and the stakeholders involved for us to achieve the zero infections that we have set for ourselves.
This is a very important thing that we need to ensure it happens. But Dr. Bonnie, what is our fate right now as a country?
Thanks. I always say that if we take it upon ourselves to make sure that we keep to the protocols, we keep to the measures in place, we will have the chance of getting rid of this virus. Look, a lot depends on us as individuals, though the government has a role to play. If you talk about our vaccination record, it's woefully inadequate, it's bad. But I know the government is trying to do something. Yes, they are doing that, but we also have a role to play. We have to make sure that we keep to the measures in place. It is as simple as that. The virus, the way it is, if we are able to stop its spread, then we'll be able to contain the virus. But if we don't do that, then we can have several waves ahead. Because so long as the thing keeps circulating in the population, then we are going to have new variants. And the new variants can be better or they can be worse. So that is what I think is our fate. We need to keep to the measures. If we keep to those measures, I think we'll be smiling at the end of the day. So that's the message I have.
All right. And Emma, let me ask you this. Now that we've all agreed that the fumigation did a lot good, what would it take for you to get back to job? And also, are you planning to support government by doing more pro bono jobs?
Right. I'll take it from the bottom. Yes, we are ready, ever ready. We have prepared ourselves. We have equipment. We have trained our personnel. We have given them their PPEs so that anytime we have to move, we are moving. One thing I would want to say, which my colleagues have already mentioned, is that it played a very significant role, the disinfection, in curbing the menace earlier. So now that we have a stronger version that is wreaking havoc, we have also resorted to getting new chemicals that are stronger and also human friendly and which has more residual effect that can stay in the system for longer. Because one thing that will happen is if people are not adhering to the protocols, for instance, they are not doing the social distancing like we saw in your shot, and they are not wearing the mask as expected to be worn, then what we can do is to do the spraying so that the residual effect will hold in the atmosphere, and if infected people are around or not, we are sure that there is something that is preventing it from spreading. So we are very, very much ready to move.
I'm grateful for your time. Emma Adjoa Apia Oseidria is with Zoom Lion. Joyce Efutu is with NCCE. Dr. Dacosta Boaje is with the Ghana Health Service. And of course, Dr. Kofi Boni is with the Noguchi Memorial Institute. I'm grateful that all of you joined us, ladies and gentlemen.